Shifting gears here just a little bit, if you have had back surgery and you now suffer from chronic back pain, well, you know you have it and you're probably debilitated and in a lot of pain. And let me just tell you this, you're not alone. The question is, how do you deal with it effectively? Dr. Alex Bigham from Novocur Pain Management Clinics is here to talk about some of the solutions that he has seen work with his patients. But first, I wanted to let you know that if you have questions that you would like answered today during our show, the doctor will be answering them for you live. Just email them to sonoranliving.com. Click on the screen where it says house calls. It should be on the right. And he's going to be here all morning. So that's where you see there right on the right where it says big old house. That's what you'll click on and we'll be able to take those questions for you live. But back to what we just talked about is this chronic back pain. Let's talk about commonalities. What is the most common sort of categories of lower back pain, chronic lower back pain?
Yeah, you always hear about the ones, your friends or family members that say they have a slipped disc or herniated disc. That's probably one of the most common conditions that people are going to get, that they're going to end up at some point possibly turning towards a surgical solution down the road. The other is stenosis, and stenosis is a degenerative condition. It's an arthritic condition, and it's caused by narrowing of the canals where your spinal cord or your nerve roots have to travel through.
And that's where the pain is incurred, is in that narrowing, right?
That's right, in the narrowing. It puts pressure on that nerve tissue, and that generates pain. And the same thing with the prior condition with the disc herniation. The disc can compress the nerve tissue, which is what generates the pain. Then the third condition that can lead to surgery down the road for some people is something called spondylolisthesis. And we've talked about spondylolisthesis before. It's such a huge word, but it's basically just where one of the bones in your back slips forward on the bone below it, and it kind of causes the spinal cord and the nerves to have to kink behind that stair-stepping effect that you end up with in your spine. It's kind of gross to think about.
Even the descriptions and the pictures, they just make me cringe because I feel for the patients.
Yeah.
So what kind of surgery would they have to incur to be able to get some sort of relief? Hopefully, fingers crossed.
Yeah. Okay, so in the first condition that we talked about, the disc herniation, that's basically, you know, your disc is made up of kind of like a jelly donut. It's got a soft interior gel portion, and then the outer portion is harder. And with the disc herniation, that center gel portion works its way out through the harder outer portion and begins to compress on the nerve tissue. So what they want to do is something called discectomy. If that condition ends up leading someone down the road towards surgery, and often it doesn't. I would say the majority of cases end up resolving on their own. Your body has an unbelievable ability to handle that condition, has little enzymes that go in there and break that down. But for the people that end up resorting to surgery, it's going to be this discectomy, and that's going to be where they're going to go in, they're going to basically remove some of the bone from the back side of the spine in order to get to that disc. And here you can see the disc on the bottom, and you can see that center gel portion with part of it that's worked its way out through the backside, and now it's compressing the nerve root and the spinal cord. Well, they're going to have to get to it, so they're going to remove some bone, they're going to go in there and they're going to clip away that portion of the gel center that's worked its way through the outside. They're just going to clip that away and take the pressure off that nerve tissue.
Okay, so let's go to the next, because we had talked about the stenosis, right?
Right, okay.
So what would you do in that situation? What would surgical?
So a surgical option in that instance is going to be something called a laminectomy. That's going to be where they're going to go in and they're going to just remove the bone on the back side of the spine. And here we have a representative, and this is frequently how they'll do it. It's a multi-level laminectomy where they remove bone from more than one level in the spine. And the idea is to decompress or take the pressure off the spinal cord and the nerve roots. So now there's more room to exist. They remove the bone and just leave it that way.
Well, and even looking at these pictures, I mean, you see why surgery really should be the last resort.
Absolutely.
Because, I mean, that's so invasive. We're seeing here in this one. Is this what we do with the fusion surgery?
Yeah, now this is going to be what they might do. This is going to be a surgery that they might do for somebody that had the spondylolisthesis, for example, with a stair-stepping effect of the vertebrae in their back. They're going to introduce some hardware that's going to basically put everything back in alignment and hold it together. And you know, there's a lot of difficulties with these surgeries. They don't always go as planned, and for some people, this is the only resort. And you know, they're really hoping and grasping at this straw that this is going to be the solution for them. And then for other people, it doesn't necessarily have to be their only solution. There might be alternatives, pain management alternatives that are available to them, because one of the most common things that we see after these surgeries is that 60% of the time when it fails, and we call that failed back surgery syndrome, and this is a very common condition, and it's interesting, Stephanie, the United States performs more back surgeries than any of the other developed countries.
Wow.
Therefore, we have more failed back surgery syndrome than any other country. And so, and we'll talk about this, you know, this is one of the things when we have failed back surgery that a pain management company can do. A pain management physician can do something called spinal cord stimulation for these people. This is a very cutting edge technology that we can utilize to help people that have already had surgery, still are in pain. This is something that we can do to help.
Well, I want people at home to know that you can help them through your clinics. And you have 2 of them, in fact, 2 Valley locations. So for more information, you can visit Novocur.com or give them a call at 480-855-NOVO, which is 480-855-6686. If you have a question about lower back pain, just let us know. Head to SonoranLiving.com right now and click on the house calls on the right side of the page. The doctor will be here throughout the show answering your questions.